I'm Greg Poulter. I'm one of the spine surgeons at OrthoIndy, and I specialize in minimally invasive spine surgery as well as advanced spine surgery. The robot's the latest advancement in minimally invasive surgery. And what's really unique about it is it allows us to plan our surgery ahead of time so we can figure out exactly where we want to go, exactly how we want to do surgery, and really have a good idea of what we're doing. And then the robot actually helps us do it. So actually one of the questions I'm often asked about the robot is, does that replace me as a surgeon? So instead of me leaving the room and having the robot do the surgery, what happens is the robot's there with me functioning as a tool. So it helps guide my hands. And what that means is that with the patient, the robot will come and basically pinpoint exactly where we want to be with our preoperative plan and then help us get to that spot with an incredible amount of precision. So within a millimeter we can place our instruments and work on the spine and do so through incisions that are tiny, where previously we would have had to open someone up and see it with our eyes directly to have that type of precision. One of the things that the spine robot allows us to do is take a step forward with minimally invasive surgery. Minimally invasive spine surgery is simply a philosophy, and that philosophy is to do the correct surgery with the smallest amount of tissue disruption or incisions or tissue trauma as possible. So a robot allows us to make the smallest incision and to be very precise in what we are doing. So much as robots have helped in prostate surgery or others, the spine robot has the same promise for us. It allows us to go in very precisely, do the least amount of damage, and still do the surgeries that have been proven to work for years previously. And so all the advancement that the robot allows for us, the biggest part for me is that it's a tool that allows minimally invasive surgery to be available to people where previously a very large surgery was required. Robotic spine surgery is still developing. It's fairly early in its lifespan. For a patient to be a candidate for robotic spine surgery, it would be someone who's having a spine fusion. It wouldn't be for someone that's having a discectomy. Now there are minimally invasive techniques that we offer for other spine conditions, but specifically the robot is for fusions at this point. What I'm happy to say is that moving forward, the robot will continue to be developed and can be used for a wider variety of spine conditions and spine surgeries, but right now it's for fusions.